Bismillahirrahmanirrahim. Welcome to the new topic. Today our topic is hypopituitarism. Hypopituitarism is a partial or complete loss of the pituitary gland. So it may be both of the lobe, the anterior and posterior. So as you know, we are discussing the disease of the anterior pituitary. So mainly we will discuss that in hypopituitarism, what are the hormones or what are the does to the anterior pituitary. So there will be decrease in the hormones secreted by the anterior pituitary, like the growth hormone, gonadotropin, luteinizing hormone, follicle stimulating hormone, thyroid stimulating hormone, adrenocorticotropic hormone. So any of these is decreases. So it is the hypopituitarism of the anterior pituitary. What is panhypopituitarism? Panhypopituitarism is when all the hormones decreases which secretes from anterior pituitary. So this condition is called panhypopituitarism, in which the growth hormone, the luteinizing hormone, follicle stimulating hormone, thyroid stimulating hormone, and adrenocorticotropic hormone, all the hormones will be decreases, as well as the prolactin will also decreases in the panhypopituitarism. So next is the causes. What are the causes which cause hypopituitarism? So there are many causes. We will discuss the main causes, that pituitary adenomas. Pituitary adenomas, like when there is somatotropic adenoma, prolactin adenoma, lactogenic adenoma, are the adenomas which occurs in the spills, because we know that there is somatotrop which secrete growth hormone, lactotrops which secretes lactogen, and other cells which secrete. So the adenomas of that particular cells can cause the hypopituitarism, and the hormone of that cells will be decreases. So in adult mostly we discuss the adenomas. And what is the craniopharyngiomas? Craniopharyngiomas is also the decrease or the defect in the pituitary gland. The craniopharyngiomas mostly occur in children, because we know that rickets pouch from the pharynx become anterior pituitary after and during the fetus stage. So when there is a problem in the rickets pouch, so it is called craniopharyngiomas, and it is in children. Then is the pituitary apoplexy. What is pituitary apoplexy? Pituitary apoplexy is it have two conditions, like hemorrhage and infarction. So as we know that when there will be adenomas or tumor, benign tumor in the anterior pituitary, so when that tumor increases in size, and we know that when the tumor increases in size, so the blood flow and the blood vessel also increases in the tumors. So when there will be a blood flow increases in the tumor, the blood pressure will be increases, and that can leads hemorrhage, and that hemorrhage cause pituitary apoplexy. Next is the infarction. So in infarction, mostly we can discuss through sheehan syndrome. Sheehan syndrome, that is after the pregnancy, when there is after postpartum, the blood loss during the delivery. So when the blood loss is, as we know, during the pregnancy, the pituitary gland needs more and more blood. So when the blood loss during the delivery, so the blood flow decreases to the pituitary gland, and when blood flow decreases to the pituitary gland, it causes infarction of the pituitary, which cause hypopituitarism, and the hormone decreases. Another causes is iatrogenic causes. Iatrogenic causes is related to medications, like when there is some radiation of the brain, so it can cause pituitary dysfunction, and that pituitary dysfunction can cause hypopituitarism. And neurosurgery, during neurosurgery, that can also lead to hypopituitarism, any defect too. Then we have cerebrospinal accumulation. As we know that the anterior pituitary, or the pituitary gland, is located in the sella turcica. Sella turcica is a space in the skull where we have the pituitary gland. So when there is accumulation of the cerebrospinal fluid in the sella turcica, it shrinks, it flattens the pituitary gland, and the pituitary gland decreases in size and loss at function. So it is called empty sella syndrome. Next is the sign and symptoms. The sign and symptoms are according to the affected area in the pituitary gland. For example, if we have the affected area only somatotrophs or gonadotropes or lectotropes, so we have that particular symptoms. And if we have panhypopituitarism, so we have all these condition. Number one is gonadotropin deficiency. So in the gonadotropin deficiency, we will have luteinizing hormone deficiency and follicle stimulating hormone deficiency. In the female, which will be the symptoms? So in the female, there will be amenorrhea, loss of menstrual cycle, genital atrophy, decrease in the genital organs, infertility, because there will be no luteinizing hormone, no follicle stimulating hormone. So luteinizing hormone help in ovulation, and follicle stimulating hormone stimulate the follicles for the ovulation. So when there will be no egg release, so there will be no fertility, so the female become infertile. Decrease libido is the decrease in the sexual thirst, and decrease pubic and axillary hair. Decrease, or we can say loss of pubic and axillary hairs. And then what will be the symptoms of the decreased gonadotropin hormones? So it will be impotence, testicular atrophy, decreased libido both in female and female, and decreased axillary and pubic hair in male. Next is the growth hormone. When there will be adenoma in the somatotrophs, so there will be decrease in the growth hormone. So the growth hormone, there will be growth failure, there will be no growth, decreased puberty, decreased lean body mass, and low bone density in adults, and growth failure and decreased puberty mostly in children. So next is the decreased adrenocorticotropic hormone. So when there will be adenomas and the corticotrophs, so there will be no release of adrenocorticotropic hormone, and if there will be no adrenocorticotropic hormone released from the anterior pituitary, so there will be no release of hormones from the adrenal gland. So when there will be loss of cortisol, so there will be weight loss, delayed puberty, and low blood sugar and low blood sodium. So low blood sugar, so it will also help us in the diagnosis that why cortisol decrease and blood sugar decrease. The next is when there is any dysfunction or there is any adenoma in the thyrotrophs, so there will be decreased thyroid stimulating hormone. So and when there will be decreased thyroid stimulating hormone, there will be decreased T3 T4 secretion, so that we will have weight gain, constipation, low blood pressure, and hair loss. So all these are the symptoms which we will have when we will have defect in cells of the anterior pituitary. If all these symptoms will be present, so it means that the person have panhypopituitarism, that all the anterior pituitary has adenomas, or the pituitary has lost their function completely. Next we have diagnosis. So in the diagnosis, initially we have to measure the growth hormone, thyroid stimulating hormone, luteinizing hormone, and insulin like growth factor. So for the growth hormone measuring, we will inject 0.1 microgram per kilogram insulin. So it will decrease glucose level up to it is also called insulin insulin induced hypoglycemia. So when we inject 0.1 microgram per kilogram insulin, so it will decrease glucose to less than 40 milligram per deciliter. And when it decreases, so the growth hormone will be increases greater than 10 milligram per deciliter. So it means that the growth hormone is normal. If it does not decrease the growth hormone greater than 10 milligram, it means that there is some problem in the anterior pituitary. We can also inject arginine infusion for growth hormone, because this is safe than the insulin induced hypoglycemia, because Arginine does not cause hypoglycemia, so it is safe, and this can also detect the growth hormone sufficiency and insufficiency. For adrenal corticotropic hormone, we will inject we will use insulin tolerance test. We will inject 0.05 to 0.1 unit per kg, international unit per kg of insulin, and we will measure the serum of the plasma cortisol. If the plasma cortisol is greater than 19 milligram per deciliter, it means that there is no deficiency or dysfunction in the adrenocorticotropic hormone in the anterior pituitary. Then we can also use Metypranone. So we will inject Metypranone. It block the cortisol from the adrenal gland. So if it block the cortisol from the adrenal gland, so there will be increased adrenocorticotropic hormone from the pituitary. So okay, so when there will be the failure of the increase of the adrenocorticotropic hormone after injection of the Metypranone, so it means it indicates that there is some problem in the pituitary or pituitary insufficiency after the injection of Metypranone, and there is no increase in adrenocorticotropic hormone. It means that there is insufficiency in the pituitary. After we have treatment, so in the treatment we will treat the cause. We will as we checked in the diagnosis, the growth hormone, the thyroid stimulating hormone, luteinizing hormone, insulin like growth factor 1. So if all hormones are normal and there is defect in the one specific hormone, so we will treat according to that hormone. If all the hormones are abnormally or there is panhypopituitarism, so we will use multiple hormone must be replaced, because this is the ultimate management or treatment. So this was all about the hypopituitarism. If you have any question, you can ask in the comment box. Please like, share and subscribe. Thank you. See you in the next video.